one question that we kind of had for you both, now that you are residents and have gone through doing electives and that sort of thing, is maybe this is more of a question for you, Seb, having done a core rotation. But how do electives in anesthesia differ from the core rotation in terms of what you feel is expected of you, or did you feel that you changed how you approached the elective versus the core rotation? Or
I think overall the core rotation is so new, and like we discussed, anesthesia, you don't get a lot of exposure to it early on in medical school, especially if you do it late in third year. It's all very, very new. And so I think staff are aware of that you're very fresh. You're just trying to understand sort of the ebbs and flows of the OR, and what does an induction look like? How are we maintaining a patient under anesthesia? What does a safe sort of emergence or extubation look like? And so just being keen, trying to soak it all in is really important in that third year. And then in fourth year, I think as you start to get a little bit more comfortable, I think just taking on a little bit of extra initiative can go a long way. And it doesn't have to be much, like honestly, just having a little bit of airway equipment prepared, helping draw up IVs where you can. Honestly, just asking your staff at the start of the day, like, where can I be helpful? What kind of teaching topics can we discuss today? I think the biggest advice that I received from staff when I was on my electives was that you are not expected to, successfully start every IV that you attempt. You're not expected to successfully intubate a patient on every attempt. And I think the same goes for junior residents. Honestly, I think I still miss an IV every day sometimes. And so those aren't the expectations, either in your third year or your elective anesthesia blocks, but rather learning, being keen, being open to feedback, applying that feedback right away, applying some of the perioperative considerations that Jay was discussing around, what are the patient's comorbidities, and how do I apply that to my anesthetic plan? I think are some of the things that you can start with in fourth year, but aren't even expected to know all yet in med school.
Quick plug for website Anesthesia Considerations. It's always a nice, handy thing to review when you are looking up your patients the night before and kind of thinking of how their profile is going to affect your anesthetic management. It's like quick little bullet points, pretty easy to read. And again, if you don't remember everything or if you can't necessarily contextualize everything, that's totally fine. If you pick a point that maybe you do want to read up on further, or like you said, bring up to discuss with your staff, that could really go a long way to show that you're interested and motivated and you're taking ownership for your patients.